lots of information, great guests in store for you throughout the half hour. Where we want to start, though, is on the serious topic of understanding stroke. And we do that with an expert who comes to us from Northern Regional Hospital. Emily Volk is a nurse. She's a manager of quality management there at Northern Regional. Good to see you.
Thank you.
And you're based out of Mount Airy.
We are. Yep.
Basically, we'll get into some other things first, but basically, what is a stroke?
A stroke is a scenario where the brain is not receiving enough blood flow. And so it's not receiving the oxygen and the nutrients that it needs that's carried to the brain from the blood.
And that can come from any number of things, a clot or anything like that.
Yep.
Now, and we have a really neat sign that we're going to show you bits and pieces of and a slogan. We'll get to that in just a second. What are symptoms and signs of stroke, basically?
So it can range. Generally, the signs and symptoms of stroke are a sudden onset, often one-sided, weakness or numbness on one side of the body, loss of vision on one side of the body. It could be speech-related, balance, those types of things.
And sometimes you may not even know that it's happening, right?
Right. We do have patients who come in and are diagnosed with stroke, and they have very mild symptoms. It could be dizziness, fatigue. So it's not always really cut and dried.
All right, but now let's talk about that. Are there time restrictions for treating stroke if you're pretty sure that's what you or your loved one's going through?
Absolutely. And our advice is to get to an emergency department as quickly as possible. Within the 3.5 to 5 hour time span from when patients were last at their normal state, we're able to evaluate them for medications that could help break up a clot that may be in their brain. People call them clot-busting drugs. So really, the timeliness is very important because every moment we will lose, millions of brain cells when they don't have the blood.
Right. Now, we have a poster graphic that I want to go through because there's an acronym of BEFAST, be fast, and I want to go through each of those very quickly. Let's start with the B. What does B stand for?
B stands for balance. So you find maybe patients are kind of leaning to one side all of a sudden when they're walking, where they're kind of bumping into walls or needing to hold on to furniture. So balance is the first.
Okay, E.
E is eyes. So it really means vision changes, generally one-sided, and sometimes they have like a cut in their vision. They won't be able to see it to the periphery, see straight ahead, but they lose that.
The F.
F is for face, and that's the typical one you hear about, where half of the face is drooping. Sometimes it's drawing up, but there's a differential between the two sides.
Okay, A.
A is for arm. It really means arm and leg. One side of the body could have weakness or numbness, difficulty using that side.
All right, and then S.
S is for speech, and those are speech changes, slurring of speech, could be just confused speech, using the wrong word, or in some cases, patients are not able to speak at all.
And then in the Be Fast acronym, we come to the letter T.
T, to me, is the most important because it stands for time. And it means get to care as soon as possible, whether that's calling EMS, which is our recommendation,
Right.
Or getting to your nearest emergency department.
I think Riley Haynes sent me an email one day when we knew you were coming on the show and mentioned something about Northern is certified as an advanced primary stroke center. How important is that?
Very important. What that allows us to do is to surround patients with all the resources that they need for quick diagnosis. If it's a scenario that we will handle there at Northern, we keep them there and get them rapidly to care. If it's something that needs intervention at a higher level of care, then we quickly get patients to a tertiary care center.
All right. Good to know. Now, I want to put up on screen for more information, just general information. You can go to choosenorthern.org. Choosenorthern.org. It has a lot of different portals you can go to find out about different specialties and services and diagnostics and that kind of thing. Very helpful. And I think having the chart, the Be Fast chart, was helpful too. And all the information you gave us, Emily, was so important. And I appreciate what you're doing.
Thank you for having me.
All right. We'll be right back after this.